Come on, you guys are graduate students. I want you to tell me a little more than that. Break it down more and try to use as much as medical terminology.
Okay, the carbohydrate is acted on in the mouth by enzyme thiamine.
Mm-hmm.
The food is chewed by the teeth, make a bolus, and it goes down past through the esophagus.
But you said two things there, which is good, right? You said the food is chewed. That's called a mechanical action. Then you said the tiling. That's a chemical action. And then you said bolus, which is good. Good. That's very good. That's the way I want to approach it, which is very good. Now continue. Someone else can help. Don't just sit and listen, please. Help as you go along. She went up to the bolus. Anything else you guys want to help her with? In fact, she did very well. What else after the bolus? It goes down the esophagus. How does it go down the esophagus?
The epiglottis open, goes down.
Epiglottis is blocking the trachea, that's
Oh,
the ear.
okay.
Don't mix them up.
Okay.
Well, how
So it
does
goes
the
down.
food move down your esophagus?
You wanna see
It's a
where
wave-like.
the
It's
first
it's a wave-like motion called peristalsis.
Okay.
That
So the peristaltic action moves the food down throughout the GI system. You have a peristaltic action. It's a wave-like contraction. Remember, Mr. Kears talked about the muscular esophagus? That muscle is a wave-like contraction like that. So you're gonna push it down. Okay? All right. And what happens after that?
pass through the sphincter muscle.
the lower esophageal sphincter. It goes through that.
The lower esophageal sphincter. Mr. What's your name again?
Selfie.
Selfie. What is that lower esophageal sphincter? What's the other name for that? And people who have not been answering. And yourself, man? The young lady down to the end there? What is the lower that lower esophageal sphincter? What's the name for it? Okay. Here, what's the name? Okay, the lower esophageal sphincter is also known as your cardiac sphincter. So it gets into your stomach now. I'm not going to ask you about the greater and lesser curvatures and fundus and all that sort of stuff. But what happens in the stomach?
It's churned by the.
You have
hydrochloric
further
acid.
movement of your mechanical and your chemical breakdown, right? Mechanical is when the stomach walls are contracting, rubbing, and pulling, breaking the food down. And the chemicals is by the enzymes. So what enzymes you normally find around there?
Amylase, pepsin,
Mm-hmm.
and trypsin.
All right, you've been doing your reading. Good.
Yes, Miss Wood.
So you have these enzymes in there that's working and breaking this down. And what else will happen? You have this big breaking down. What else happens in this stomach? What else joins this acid? This irregular acid.
Hydrochloric.
The hydrochloric acid comes up inside the stomach also, right? And then this food leaves the stomach in the form of what?
Bolus.
No.
Chyme.
There's a
Chyme.
bolus on the top. It leaves in the form of chyme.
Chyme.
Exactly. So it leaves in the form of chyme. And what's the difference between the chyme and the bolus?
The breaking down, the enzyme.
You tell me in your own words. What's the difference between the bolus and the chyme?
So I think the bolus is not breaking down to the stage where to the point where the nutrients can be taken out of it as of yet. But when it's breaking down to chyme, it's going from there to the first portion of the lower intestine. That's where most of the nutrients is extracted from the food. So I think when it's in the chyme form, it's prepared to extract nutrients and stuff for the body.
Okay, so that's good. So, but that's good. But what I was looking at is very simple. When the food comes in your mouth and you chew it up and you swallow it, it's broken up into little pieces, right? Called bolus. And if you vomit it up back after just finish eating, what do you find? You find that the pieces or chunks will come up back, right? And you call this what? When you write in your progress note, undigested food, right? These pieces that you vomit up back. But when it's broken down into chyme, it's more now in a liquid form. So when you look at the two, you see one is pieces and the other one is liquid. So that's a basic.
Okay.
So now it leaves the stomach. And now what happens next?
And the duodenum, the first
It
one.
enters the duodenum. And what happens in the duodenum?
That's where nutrients are taken off out of the food for the body. No?
A lot happens in the duodenum. What happens in the duodenum?
Bile is mixed there too.
Bile is mixed there too. Where's the bile coming from?
The common bile duct from the gallbladder.
Bile is coming from the gallbladder. And it's coming down the common bile duct, right? And where is this bile produced?
Liver.
From the liver. So the liver produces the bile. And what's the function of bile?
Emulsifies fat, give color to the stool,
Emulsification of fats.
color to the stool.
Gives stool its color. What else? The odor.
Oh, okay.
And come down through the common bile duct. And then not only you get bile coming down there, what else happens to the duodenum? Because you can't talk, let me put it this way. You can't talk about cholecystitis, cholecystectomy. You can't talk about jaundice situations if you don't know what you're talking about. All right? Just drop it. So what else happens? We're just doing the common anatomy and physiology, basic anatomy and physiology, nothing in depth. All right, so next it goes from the common bile duct to the bile, then you have the pancreas being involved. Is that so? So what you get from the pancreas? Pancreatic enzymes, you're absolutely right. And what are pancreatic enzymes? Give me a copy. You're doing well, you're doing well. The lipase will be one of them. Come back again. And look at your trypsin again. But also, something else is produced in the beta cells of the pancreas.
The insulin.
Insulin from the islets of Langerhans, right? So you produce that for regulation of your what?
Sugar.
Your sugar, your blood sugar. And now it enters the duodenum. You enter the duodenum via what?
Duodenum.
How does it enter the, where does it enter the duodenum? Now it enters through a perforation, a hole there called the ampulla. Now it moves on from there, you have some amount of absorption start taking place, right? It goes through what next? After the duodenum is what next? The what? From after duodenum is there?
Jejunum.
The jejunum.
Jejunum.
And then your
Ileum.
is where most of the absorption will take place. And you gotta know that because the absorption has to take place someplace. And when it's being absorbed now, in what form is it being absorbed? What are the end products, I should say? What are the end products? Hmm? What are the
When
end
it's
products
being-
of
when
the
it's being
different
absorbed.
breakdown that happen? The body can't utilize your food unless it's broken down, right?
Mm-hmm.
And can't utilize that food unless it's being absorbed. And it's not gonna be absorbed as protein, as carbohydrates as you know it. So what does these turn into? What does
Waste.
carbohydrates turn into?
Waste.
What does protein turn into? What does the fats turn into? You
Not-
don't get
not
them
waste
just
yet.
like that.
Not waste yet.
Come on, what's the end product? What's the end production of
Trypsin,
proteins?
glucose, amino acid,
Amino acids, proteins.
protein.
Glucose, carbohydrates.
Carbohydrates,
Fatty acids and glycerol will be your
fats.
fats.
Mm-hmm.
And the fatty acids and glycerols and proteins, which is now your amino acids, that is how the body is going to utilize it. It's going to be absorbed. And when it's absorbed, what happens to it? When this has, the nutrients have been absorbed, what happens? I just give you the final end product, right? The glucose, amino acids, fatty acids, and glycerol, right? The main products are your macronutrition, right? What happens to it?
It goes now to the large intestine, no?
No.
I think that's
Just
when-
start with the absorption.
Okay.
One is-
You tell me your food, we just start with what was just absorbed, right? We give you those names. So what happens next?
Goes to the blood.
Of course, when you, the final end product is glucose, it becomes glycogen for storage. But what happens next after these things have been absorbed?
Distribution
No, come on guys.
in the blood.
Yes, definitely gotta go in the blood. Everything gotta go into the blood, right? Because the blood's just picking up everything. But what happens with it?
It goes to the organs that it needs, that's needed.
It goes to one organ first. It goes to the liver for detoxification. Come on, guys. Everything has to go through the liver first before it goes around the body, before it's being picked up by the other system. So you have to have this what? Detoxification. That's a function of your liver.
Yeah.
That's why you can't live without your liver. So nothing just goes and go around the body. It has to pass through this middleman first. And then this middleman's gonna send it on to other parts of the body. All right? And then after that, what happens to the rest? What's happening to the rest now? Come on, this is supposed to be a review. A review we talk about. Come on, let's move faster.
Good evening. Mr. West, please excuse me, I had to rush to come here. I didn't get a chance to get in church.
You interrupting my class? All right. So, what happened next?
After
We gone to the liver, the digestion continue. What's next?
it's been filtered by the liver, now it can go to the organs that it needs it. that
Right.
needs it.
But what happened to the rest of food that was there?
Oh, it goes become waste.
Right. Wait.
Waste
And now
product.
it's gone to where?
The large intestine.
Intestine.
Large intestine. The large intestine made up of different parts, right? And why do you think now that you need to know what the large and where the different parts of the large intestines? Why do you need to know what is ascending, what's descending, what's transverse, and what's the sigmoid colon, the sigmoid flexure and the rectum? Why do you think you need to know that?
Does each part have different
Elimination.
function?
For elimination, just elimination?
Each part has
Absorb,
different
the water is
function, right?
further
Yeah.
absorbed in the large intestine.
Water, a continuous observation of absorption,
In the large
right,
intestine.
in the large intestine, exactly. What else?
Feces form.
Feces form for
Elimination.
elimination. Okay. Let's jump out of the GI system now, and let's move on to another system, because we just quickly review the system before we get into any pathophysiology. Next is what? Give me another system.
Reproductive system.
The what?
Reproductive system.
Reproductive system. I wonder why you're picking reproductive system. Yesterday. All right, let's go quickly. So tell me the reproductive. Let me just both female and male, right? So let's start with the female reproductive system.
Reproductive system.
Everyone quickly, guys, let's go through the female reproductive system.
The ovary is the main female reproductive organ. Is it organ?
You have the ovaries, the uterus, the vagina.
Right.
Ovaries,
hormones.
uterus,
Mm-hmm.
the hormones.
Estrogen, progesterone.
Estrogen and progesterone. It's good.
You have the eggs
Estrogen, progesterone.
in the
And the fallopian
the
tube.
fallopian tube. You have the eggs in the ovaries, which mature and then travel to the fallopian tube where fertilization takes place. And then after a few days, it moves on to the uterus for implantation. If it doesn't move, then you have a ectopic
Pregnancy.
pregnancy, which has to be removed.
Okay.
If no pregnancy takes place, then the lining of the uterus is shed as the menstruation.
Good.
4 or 5 days, some longer. Everybody have different cycle, 28, 30 days.
Okay, so you kept reading.
I bet so.
You kept reading. You kept reading a lot, which is good. All right. So what's the ovulation process now? She give you a lot. She tell you about the egg where it produced. By the way, that's the ovum, the ovum. What else?
The ovulation process.
So the ovulus.
What's the ovulation? Come on. Ovulation.
The ovulation process takes place like 14 days, 2 weeks after menstruation.
Just tell me the ovulation, because it's so important that you understand the ovulation process. All right, so I'm just gonna quickly, because we don't have the time, so I'm just gonna quickly run through. You have the ovaries, you have 2 ovaries, right? And these ovaries, inside of it, what produces the ova, the ovum. And inside of it, you have a cell, the Graafian follicle. And the Graafian follicle is responsible for development of your ova or egg. But this cannot occur unless you have something called FSH, follicle
Follicular stimulating hormone.
hormone. So Graafian follicle, pituitary gland sender, follicle stimulating hormone. And then for it to continue, you have something called LH, the luteinizing hormone.
They work together.
Now it's going to develop, and why is it developed? It's producing something called estrogen,
Estrogen.
right? And the estrogen helps in the development of your endometrium, which is the lining of your uterus.
Innermost
So it
lining.
thickens it prepares it for the egg.
Mhm.
At that time of ovulation, the egg is released from the grafting follicle and it enters
Fallopian tube.
into your fallopian tube. Now when it leaves the grafting follicle, the grafting follicle don't just give up now and say my job is done. The grafting follicle now changes its name to the corpus
Corpus
luteum.
luteum.
And the corpus luteum is now what is going to produce
Estrogen and
your progesterone,
And
which is to
estrogen.
maintain the pregnancy.
And
So when
estrogen.
this ova leaves, you have some finger-like projections at the end of your fallopian
Fallopian
tube
tube.
that pulls it into the
Fibrio.
fallopian tube.
Fibrio. Fibrio.
Fibrii.
Fibrii.
And then the first part of the fallopian tube is not a big problem. The second part of the fallopian tube is the one you're gonna remember.
Ampulla.
And that's the ampulla,
Ampulla.
right? And the ampulla, not the ampulla, that's different.
Right.
This is an ampulla only. And the
Ampulla.
ampulla is where
Implantation.
fertilization takes place.
No,
That's where the
fertilization.
egg is fertilized by the sperm,
Sperm.
because the sperm's got to go all the way up there.
Mhm.
Now to become fertilized, the egg is not just no longer an ovum, it is a zygote. And then the zygote start to move down, farther down the
Fallopian
fallopian
tube.
tube, and it changes the name to the morula.
Mhm.
By the time it reaches the isthmus of the fallopian tube, this morula gets into the uterus. And that nice bed that was prepared, and that nice bed was prepared is called the endometrium, right?
Mhm.
It now gets implanted in the endometrium and become a blastocyst. If that implantation don't take place, that's what you call the monthly menses,
Menses.
the stuff that you shed. Alright? This blastocyst will now have something called a trophoblast that will develop into your placenta. You have to block that hole. Alright? Into your placenta, which is where the development of the what? The baby will take place, but it's a fetus, because until it gets out of the body, it is a fetus. Alright? Time frames are very important. Like what happened at 4 weeks, what happened at 8 weeks? When you're gonna hear the first heartbeat, the fetal heart rate. Our news register nurses have to know that FHR is a must. It is not a maybe. You have to know FHR for your studies. Not time to go in and do working in any maternity ward, but for this NCLEX you need to know it. Fetal heart rate and fetal heartbeat. Right. Auscultation. The instruments is used. All right, let me jump out of that and let's go straight over to another system. Circulatory system. Okay, so what's the circulatory system? Somebody come talk. Somebody who didn't talk. This young lady did a lot of talking. I guess from the time I left you guys, you have read. That's good. So let me hear about the circulatory system.
Isn't that the blood?
Circulatory system is also known as the cardiovascular system.
Okay.
So anybody start talking.
The cardiovascular system is basically referring to the heart. There is pulmonary circulation, then there's a systemic circulation. The blood goes from the superior and the inferior vena cava, enters through the right atrium, and then it goes from the right atrium to the bicuspid valve. No, tricuspid valve. Not the bicuspid. Tricuspid valve into the right ventricle, and then from the right ventricle, it goes through the pulmonic valve into the lungs.
All right, somebody else take over.
The heart has 4 chambers.
Hmm?
I said the heart has 4 chambers. Right?
Right, but he stopped
Okay,
off at where
into the
from the
lung.
pulmonary.
Okay, so
To the
it-
lungs.
Okay, so that is where the exchange take place, the lungs, right? So the deoxygenated blood
Turns to
turns to oxygenated blood, right? And then it goes back to
the pulmonary
the pulmonary, right?
ventricle. No,
No.
pulmonary.
No, not the pulmonary. Is it the pulmonary artery? No.
I think the
The
pulmonary
left,
arteries.
it's the left.
Yes.
Are you guys talking about yourselves? Or are you talking to everybody?
Or to the whole class?
It seems like you guys are just chatting
The
with
left
yourself.
ventricle, right?
Then it goes to the left atrium first.
The left atrium.
Right, through the pulmonic valve to the right atrium, and then continue. And then from the pulmonic atrium, it goes through the bicuspid valve
Yes.
to the left ventricle. The bicuspid valve, also called the mitral valve, through to the left ventricle, and then from the left ventricle, it goes to the aortic valve, and then from there it pump. I'm sorry, I forgot to mention. After it comes from the lungs, that is the completion of the pulmonary circulation, and then now that it pumps from the aortic valve to the rest of the body, that's known as the systemic circulation, and that's all I can say.
From the aorta to the different part of the body.
Exactly.
And that's it. It says cardiovascular system, so you still got a lot to talk about. Let me hear what's the rest. Come on, some odd people are in. Just add it. Whatever you know, you just talk.
Coronary artery.
You do a lot of talking. Let me hear the other stuff. I know you know it. Let me hear the other stuff. Come on, you gotta bring it out to view now. And that's the only way you can understand where you're at, so we can work. Okay? So talk to me here. Talk anything that you know. Talk anything that you know. Man, Sophie, talk anything that you know, right? Talk anything. Anything. Let me hear about the cardiovascular systems. And you guys shouldn't be looking up anything. It should be there.
Okay. So the heart has 4 chambers. That's all.
Nah, that's not for
Okay.
you. It's not
So
for you.
what pulmonary circulation? What it does it?
You're talking about the cardio.
I'm not telling you guys just to talk to me about the common, the basic stuff, because before we get into the cardio, before we get into any disease processes, I want to show you guys know what different systems are and how they're affected and why they're affected, so you can make that comparison.
The left side of the heart is more muscular because that's because of the force it uses to pump the blood from the aorta to the rest of the body.
From the aorta or to the aorta?
Hmm?
From the aorta or to the aorta?
From
Two. From the left ventricle to the aorta.
Good. You guys are listening.
okay.
Good.
It consists of heart and blood vessels,
Good.
And
and it's It's from high
To the
blood cell,
aorta.
and the primary function is the transport of nutrients.
Right, that's what you're reading. But what I want to hear, and for the persons, I think you, who are there's some contact, remember that what I said. I said that when you do the cardiovascular system, you do it in three sections. And when you do the disease processes, you do it in the same three sections. Cardio, the root word from your what? Medical terminology relates to the heart.
Heart,
Vascular is going to relate to the what?
vessels,
Veins.
vessels,
Veins, the arteries, the capillaries. And the third component will be, come on, the blood vessels, the blood cells. Your erythrocytes, your leukocytes, your thrombocytes. Because how are you going to be talking the cardiovascular system if you don't put those three together? Because the blood has in it, what's the composition of blood? What's the blood comprised of, guys? Come on.
Plasma.
Oxygen.
Hmm?
Um,
What's the composition of your blood?
plasma,
Plasma.
Red, white, blood cell.
Plasma,
plasma,
right? What else?
Cell.
erythrocytes,
Erythrocytes,
leukocytes,
thrombocytes.
thrombocytes.
That's the combination of your blood. I'm going to, we know that other things, but just the basic stuff. And those are three areas. Because now when you talk about disease process, you gotta know that with the red blood cells, you're gonna, if you don't have the hemoglobin with the iron or what have you, you're gonna get what? Anemia.
anemia.
With your white blood cells, you could get leukemia and leukocytosis and all this problem. With the thrombocytes, your blood in clotting.
Clotted.
That's why you need to know these things. Your plasma, less plasma, you can end up into what? Hypovolemic shock. And kick the bucket. That's why, guys, no, you gotta understand the different part, right? It's not just because you're saying, hey, you got blood cells. You ain't not but blood cells. Every one of them has a situation that can occur that can lead to a disease process, right? And based on what is happening to the patient, that's how you will take care of the patient. If the patient had the red blood cell that give them what? Anemia, then you know this patient has to be taken care of in a certain way. As opposed to the patient that the blood is not clotting. Like a patient who is what? Whose blood don't clot? Come on, guys.
hemophilia,
Patients don't have
hemophilia,
Hemophilia. Where the mother passes on to her
son,
son. RH what? Negative to
Negative.
RH positive. This whole difference. That's what I'm trying to tell you guys right now. There's a difference in how you will take care of the patient based on what the underlying cause, as you as a nurse. All right? All right. Cardiovascular. Let's go to something else quickly. Overview. Another system. Muscular system. Anybody, lead off quickly, please. You guys are not supposed to even look at nothing. They're supposed to be coming out of your head like this, because right now you guys are that sick. Some people already passed and graduated, and some of you are on your way. So come on, let me hear what you have in your head right now. Because that's what you're gonna do. You're gonna have a book when you go to do the critical, when you go to do the exams. You just have your head. Muscular system.
The muscle-
Movements.
the muscle
What?
innervates with the bones for movements.
Muscles is used for movement.
So ligament.
Also,
The smooth muscle is called.
right, striated, and
Voluntary, involuntary.
The striated
Anybody else
muscles
remember
is
muscles?
voluntary, right? The
Guys,
smooth
Fine.
muscle is
Guys.
voluntary.
Posture.
muscles, we know it's a movement, right? Because muscles contract. But when muscles contract, it's not only for movement, they contract for what?
For
When you're
heart,
shivering, what's happening?
the muscles contracting.
Right, why? For temperature.
Thermoregulation.
Come on, guys, temperature regulation. The muscle for temperature regulation and for movement. Look at the normal things that happen around you. You go outside, you start to, and the muscles start to do what? Right,
Contract.
because it's contracting faster, generate what? Heat. So there you go, temperature control, right? Regulate temperature, your muscles, movement. So from there now, you're gonna go into it by looking at also if muscles contract. And contract brings one bone to another bone. That's basically what it does. Bone towards bone. That's why we have muscles. Alright? Bring your hand up, your fingers go into your face. Your face has facial bones. Your fingers have bones. That's the whole purpose of it, right? But you want to know now, so some of the muscles I can control, and other muscles I can't
Cannot
control.
control.
Voluntary and
Striated and
So we have
Smooth muscle.
voluntary, involuntary, striated, smooth. But they said there are 3 types of muscles. So you give me 2. You just give me smooth, you give me striated. Cardiac muscle. The
That's the
smooth
heart.
muscle, you have no control. The striated muscle is also known as your
voluntary.
voluntary, but what else? Come on, guys. What else is it known as?
Skeletal.
Skeletal muscles. Remember I just said move bone towards bone? And you got control of this. You want to punch me? Right. You have that. Skeletal control, right? You have control. But can you control your heartbeat?
Nope, that's cardiac muscle.
But they do say that the cardiac muscle, the way it's built up as if it looks like a what? A striated muscle, which is skeletal muscle, but in fact the control is more smooth, involuntary control. Now, you have these different type of muscles, and like for instance, a woman get pregnant. You can have uterine contractions, and uterine contractions are caused by smooth muscles. You have no control over it, and the baby the fetus will be what? Expelled. And when it's expelled, it can be called a spontaneous abortion. And when you have a spontaneous abortion, you may have stuff left in the uterus still. Everything don't come out. And it's called an incomplete abortion. And that's when you do your dilatation and curettage. But then you gotta know how the uterus is made up. If you just stop with it, that's not right. It got the endometrium, plus it got those smooth muscles. Right? Okay, so we move past the muscles. What's next? Come on, give me another system fast that you did.
Respiratory.
We talked with respiratory already.
Urinary.
Urinary. Damn, with urinary, I want to go to the bathroom right now too.
That's so good.
But I think the guy went to the bathroom already, so I gotta wait. But as you know, with the urinary system, you have to control the flow, right?
Yeah.
And right now I'm trying hard to control the flow. So I'm walking and my toes I'm squeezing it together so that I don't pee myself.
Stop that.
That way I pee myself. You
Urgency.
guys gonna do what? Laugh at me
Take it to the.
and what have you. And that means that I cannot control my bladder. If I can't control the bladder, it means that I am incontinent. I'm no longer continent, I'm incontinent. But then when you're incontinent, it can be due to what?
Your kidneys,
What makes you incontinent?
your bladder.
What muscles? Sphincter. Sphincter. The sphincter muscles control the flow of urine. And you have control of that one. Right? And which sphincter? Which sphincters have you control of the urine? What sphincter? You got lots of sphincters all over your body, right? You talk about one in the GI system and what have you. So what sphincter are we talking about? There you go, urinary. That's the only thing we're talking about, urine. So urinary sphincter. Come on, guys, think about it. Right? So you have the urinary sphincter muscle that controls that flow. But when we get that urge to pee, like I got the urge right now, what causes that? Why are you laughing? What causes the urge? Hmm? What causes the urge? When you get the urge to pee.
Because your
Pressure.
bladder is full, the blood,
Pressure.
the bladder is
What pressure? What pressure? What the pressure does?
Press on.
Press down on
Press
the
onto
blood.
the bladder.
Press on the blood. It's already the
The
bladder.
triangle.
On the trigone.
Triangle.
Once it's pressed on the trigone sends a message to the brain that says,
Oh,
you need to go.
Triangle.
Alright, so that's what the trigone is about.
Triangle.
So this urine that's in the bladder is known as a reservoir, right? Is that so?
Yes.
And what reservoir is used for? Holding stuff, right?
Yeah.
Like you want water, you
Yeah.
have a reservoir for water, right? All the water that's coming into New York is coming from reservoirs upstate New York and in Jersey and these different places. They keep water, right? So your bladder is a reservoir for urine. And is urine clean?
Yeah, until it come out.
It's clean until it come out. And when it come out, it is not clean?
When it is not clean.
Why
They
not?
used to drink
Depends on where it come out in. Like if
Where
you
it come
catch-
out in?
Like if you, like if you do a clean catch urine, like
If you do
in
clean
a-
catch urine, okay.
That's
And why do you do clean catch urine?
for certain
tests.
tests.
For tests, so good, there you go, very good. You don't want
Guys are
contaminated
doing
samples.
good, man.
All right, so when your person pee, you said it's good, right?
Yes.
Would you drink somebody pee?
No,
Why not?
they used to.
But people do.
We have water, we have enough water.
You have enough water.
What happened? What she said?
But people drink the
They
urine,
used
just
to
like
do
the
it.
You know, back in the
Terrible.
days when the children get asthmatic attacks and what have you, the parents used to give them their own pee to pee, to drink.
Yeah.
All right? On different situations, different based on the cultures, they would drink it. And what would you as a registered nurse say?
What would I say?
Well, you as a registered nurse would say, a parent comes out, give my child the urine and the
Say
pee,
no.
I give it. Why would you tell them no?
Water.
You have to educate them.
What you, yeah, but what you educating? You're doing patient teaching, by the way.
Right.
What are you patient teaching about?
Hygiene.
What do you mean by hygiene? Be very specific.
Urine.
Why are you gonna tell people not to do something?
Urine.
There must be a reason. There must be a what?
Urine is acidic, correct? It's acidic.
Have any of you drank urine in this room?
No.
No.
But I know people that did. This girl at my job, she said that's her culture. She's from Haiti. And they drink urine. I'm serious, man. That's what she do. And if I was like, oh.
A lot of you, how many of you have tasted urine?
It's salty.
How many of you tasted your urine? Take your hands in your urine and taste it.
Golden shower.
None of you have tasted urine?
I try to put a bag on the baby and he shoot up, you take off the diaper and he shoot up the pee so
On your
quickly.
face.
Yeah.
What about if you have the urine, somebody else's urine? If somebody peep on you, it's not a problem, right?
Golden shower.
Why guys like golden shower? I don't know golden shower. For people, that's a sexual thing. But actually, if we say not golden shower, but if person's involved in oral intercourse, a lot of people do oral intercourse, right? A lot of people do oral intercourse. And if the man just or the woman went to the bathroom, do you think there's gonna have urine still in the penis or
It's
vagina?
possible.
More than likely you'll have it still there. Because even though you may wash it, just like you wash your hands, you don't get off everything. Same thing with that. So somewhere or the other, you had urine sometime to taste. And you know those guys up in space, in those rockets that go up into space, in the what do you call that, space station?
Right.
Yeah.
They utilize their urine. They just put back in the thing and they make what?
Water.
Water to drink. Because what's the percentage of water in your urine?
96.
96.
So you have a lot of water, it's only 4%. And would you advise someone to drink the urine as you were talking about just now?
No.
Why not? Remember, I want to hear rationales. Don't just tell me no or yes. Give me a reason why. Give me a
Yes.
critical thinking.
It's acidic.
You say acidic. Well, acidic, okay, it's acidic. So what is the acid's going to do?
And it doesn't taste good.
So acid makes it good. So you're like, what about green mangoes? Isn't green mangoes acidic?
Yeah.
And then
Sour,
oranges is
some of them
acidic?
sour.
They're all acidic.
You have
So why is it that you say that the acid from the urine is not good?
Talking
Oh, yeah?
about
It's what? Why is this dirty? You just said it's 96%
96%
water.
of water.
Take a drink.
All right.
It is.
You heard she said clean cat urine, right?
Mhm.
Because you don't want to contaminate it. You do not drink other people's urine because it might have bacteria inside of it. If you take your urine yourself, it is not a problem because it's coming from you. What's already in your body is there.
So just going back in.
Right. But for another person, they may have bacteria in their urine,
Right.
maybe coming out not from the urine that is coming from the kidneys, but urine that might be passing through what? Your urethra.
Urethra.
And it picks up the microorganism as it passes through the urethra. So now when you drink it or whatever you do, you can get a problem. All right, so that's with that. So now you got more up into the so that's a bladder. And what brings the urine to the bladder? Come on guys, we gotta move faster.
Ureters. Ureters.
The ureters. And what takes the urine out of the bladder?
The
The what?
Filters.
No. The ureters bring it to the bladder. What takes it out of the bladder now?
Yeah.
urethra. She
The
said it.
urethra.
Yeah, she said it.
Not ureters, urethra.
Urethra.
Okay. And where is this urine coming from?
Kidney.
The kidneys. And what is bringing the stuff to the kidneys? What is bringing stuff to the kidneys to be filtered?
Blood.
Mm-mm.
Yes, you're absolutely right, blood. What blood?
The blood that we.
Artery.
Hmm?
The artery. The
Absolutely, you're right. The artery.
Arteries.
But what artery?
renal arteries.
Renal artery, that's
Renal
it.
arteries.
Everything that's coming, gotta come by there, renal
Renal
artery.
artery, mhm.
And the renal artery now, gonna bring the blood to there, and somebody, what's in the different parts? You know, you have your calyces and your medulla and your pelvis and all that, your kidneys. But the part that is responsible for the filtration is known as your
Glomerulus.
glomerulus.
Oh,
Glomerulus.
And in the glomerulus, you will have the what? The Bowman's capsule.
Bowman's capsule.
And the loops.
Loop of
Right? Collected tubules.
Yeah.
We gotta know this because when a person, and all this there is called a what? What are the cells here called?
Nephrons.
So when you hear about nephritis,
Nephritis and
glomerulonephritis, they're talking about these nephrons that is being affected. Now what's happening up there in the kidneys? You can have a problem. You could have the kidneys, you could have kidney stones, right?
Mm-hmm.
And a kidney stone is known as
Cholelithiasis.
what?
No? Okay. Forget I said that.
no, that's not it. What is this one?
Renal and nephron.
Renal calculi?
Yeah.
Renal
Yeah,
calculi.
yes, renal calculi. Yeah.
Safe,
Guys,
safe,
pull it
safe.
together, pull it
safe.
together. Just discussing. I haven't gone into
Renal
right. So you could
calculi.
get these stones forming, renal calculi, and these stones could also block and cause problems, right? But we're not doing problems right now. We're just going through the normal situation. All right. What other system? I need to.
Another system?
Sorry. Be right back.
We did the GI system already? Did we do a GI system? We did it?
Lymphatic, I think we didn't.
Did we do the respiratory?
So guys, you ready?
That was the first one. Lymphatic.
You guys ready to
Did
go
we do
take
the,
a
did we do the nervous system?
Yeah, they're not here. Or the lymphatic system, right?
What about the endocrine? Endocrine.
You did lymphatic system already?
No,
Lymphatic.
lymphatic, nervous, endocrine.
Okay, those three left. Okay, nervous and endocrine. Nervous system.
Y'all did the skeleton already? You did the skeleton already? That's a big one.
Just touch a little bit with the muscle and the bone, but
Mm.
the framework, the muscle, the skeleton.
You guys getting ready to go to your exam?
We have to get ready.
You don't have a date yet, though?
No, we're not here yet. You here?
No,
No, we're not done yet. We're not done yet.
Oh, you're still in class?
Yeah.
When you graduate?
Next month.
Oh. We just teach
June.
June, yeah.
June,
Who
June,
is the
June.
teacher? Same teacher.
Mr. West.
Mr.
Okay.
West?
No, we
Mr. West?
graduated last year.
Oh, yeah, graduated. Oh, so you're preparing for the
Yeah, we did.
NCLEX. Oh, that's good.
So you
Congratulations.
study the U world? You do the U world?
No, I haven't done it yet.
Oh, it's good.
What about Archer?
Start.
Did anyone of you use
I
Archer?
heard about it. Good?
Archer is good too.
Yeah.
Archer is more affordable.
Oh,
And Archer give you an actual video review. You will just give you questions.
okay.
I have both.
You have both?
I spent so much money on this thing.
I know.
Okay.
I have both.
Right. Can we continue now?
Yes.
All right.
Go.
Go.
Could you talk to the whole Jesus? Relax, man.
I have you world. I
So what's the
have
next system?
Archer. I have Kenho. Kenho is for anatomy.
Lymphatic system.
Kenho is for anatomy. I have Kenho for
So
life.
what do we know about the lymphatic system? What's the function of the lymphatic system?
Drainage.
Come on,
Lymph
guys. What's the
node.
function of the lymphatic system?
Okay. The hormones.
I see people going through books and the computers. So I want to work in your mind right now. You guys supposed to already done this and know it. So bring it out to your mind. Because remember when you go up for the state boards, you got to go back into your mind and, bring it out. Open up those doors. What your lymphatics does for you.
It gets rid of body waste,
Hormones? No, that's endocrine.
No?
That's
Gets rid of
endocrine.
body
That's
waste.
endocrine. That's endocrine.
toxins and things like that. Rid the body of lymphatic system, rid the body of what toxins.
A lot of people don't focus on the lymphatic system. And for why I don't understand, because the lymphatics is very one of the main systems
It's a
in the
part of
body.
the immune system.
Right?
Is it a part of the immune system?
It's
Okay.
part of your immune system.
Okay.
When you talk about the
And it's in
lymphatics,
the
you're going to talk about the
vertebrae.
lymph nodes.
Right.
There are over 600 of those. You're going to talk about your lymphatic cells, such as your B cells and T cells. That helps in the fight against infections. You're going to talk about the return of fluids into the blood. Because every time you have exchange at the level of the capillaries, fluid is lost. And that plasma that is lost must be returned back into the system, or else you will die. And that plasma that is lost at that level there, the capillaries, it happens all the time, every second of the day, it's happening. And that plasma now turns into something called lymph. And this lymph now is returned back to the blood so that you will not end up with something called hypovolemia. So it plays a very important role. A lot of times you have swellings around the place, like P. demons and what have you, is your lymphatic system involved.
So when you have the lymph nodes under your arm, it's not the deodorant you change, cause it?
Not necessary, so.
Oh,
The lymph nodes, remember, what does the lymph nodes do? The lymph nodes filter. When it's coming from the blood, because remember, at the exchange of the capillaries where everything takes place, you have this fluid being lost. And in the blood they may have microorganisms. And they are got now into this fluid. And this fluid now, the lymph, gets into the lymphatic system. I have these nodes all around the way. And what happened, these nodes now what? Capture these microorganisms, these germs. And that is why you end up with those swollen nodes. If you get a cut in your finger, you find it under here gets swollen. You get something on your foot,
Your groin.
you find you get it up in your groin.
Yes.
Right? Because the lymph nodes now are trying to filter your blood to stop the not your blood, your lymph. It's trying to filter it, so when it throws it back into the blood system, you don't have those microorganisms to cause a problem. And that's just how infections in the lymphatic system work. And you guys, make sure it doesn't vibrate, okay?
No, no, you're good.
All right, let's look at another system quickly. Endocrine system. What do you guys know about the endocrine system?
Endocrine system.
What about hormones? She said hormones. What is it you understand with hormones?
They're messengers.
They're messengers, absolutely. They carry messages, but they carry specific messages. Right? Instructions for different body organs to do different things. Just now we just talked about FSH, right? But we talked about the female and the LH. They're hormones, right? Do not mix up the hormones and enzymes. Look at the difference between hormone and enzymes, please.
What is the difference between hormones and enzymes?
Look at the difference between, because you're going to see enzymes and you're going to mix it up with hormones, or you're going to see hormones and mix it up with enzymes.
The crucial difference between hormones and enzymes is their chemical composition. Almost all known enzymes are proteins. Hormones, on the other hand, can either be made up of protein, amino acids, or even steroids.
Now look at the difference as it compared to now the functions.
Hormones are molecules, usually a peptide or steroid, that is produced in one part of an organism and triggers a specific cellular reaction in target tissue and organs some distance away. Whereas, you said hormones and enzymes, right? Whereas enzymes are the biological catalysts which speed up the rates of biochemical reaction without undergoing any changes.
So it's called metabolism.
Metabolism.
Okay.
So when you have the metabolic changes that occur, that is usually caused by the enzymes. And your enzymes, like you talk about the GI system, talk about your lipase, your trypase, your trypsinogen, your amylopsin, all these different things are enzymes. They break down. Therefore act as catalysts. They break down substances and make it now more usable by the body. Okay? Because remember when you talk about metabolism is broken into anabolism and catabolism. And everything that's been done in the body is to maintain homeostasis, balance of your bodies. And where would I find these hormone glands?
The hypothalamus.
Pituitary, thymus,
Where do I find the pituitary?
Up in the head.
Up
in the
head.
brain,
Behind the back of
under the hypothalamus,
the under
Hypothalamus.
beneath, superior, inferior.
Right here.
Mm.
Side of your head. The pineal, the
Pineal body.
Pineal.
Good. And then you come down into the throat, you get
Thymus,
Thomas. No?
yeah.
thyroid.
thyroid, yes.
And
Parathyroid.
then you start going down, lower down, you get a whole lot of different ones
Renal.
that will give you all of the
Adrenal.
Allison's disease and what have you, because the adrenal glands, you have your testosterones,
Mhm.
you have your, what else? Estrogen,
Estrogen,
you have your progesterone.
testosterone.
All right, let's move on. What next?
skeleton.
Skeletal
Skeletal.
system.
What about the skeletal? Come on, guys, we gotta move, we gotta move.
Framework of the body.
Hmm?
You have to put on,
There's a framework.
you have the skull in the head.
You have the skull. Give me another name for the skull. Give me
Cranium.
The cranium. Why you give me skull? Give me cranium. Stop professional. That was no skull. Let's go. Cranium. Mm-hmm. And what else? What is skull made up of? Hmm? What is skull that you're talking about? This cranium. What is it made up of?
It supports the body.
No,
What
no.
is
What
it
is
made
made
up
up
of?
of?
Flat
Now
bone.
listen to me.
Yeah, the
Flat bone.
flat
Flat
bone.
bone.
Flat bones.
flat bone.
So if you have flat bones, what other type of bones you have?
Irregular bones.
Irregular bones. And
Long
where do I find
bones.
irregular bones?
In your
Regular bone. Yeah, your rib cage.
Vertebra.
Your vertebra.
The
Vertebral
vertebrae
column.
column.
and rib
What
cage.
other bones?
Vertebrae,
Come on,
rib
guys.
Short bone, long
Collarbone.
bone.
Short
The
bones and long
collarbone.
bones.
Mhm.
All
The
right?
shoulder bone.
No. Stop your
No,
noise.
long bones.
We're going with all the shoulder bone and collarbone. We talk about the type of bones. No. We talk about type.
Connected.
Right? Which is your irregular, your flat, your short, and your long. With the four. All right, four. Then in the four, you're gonna now pick up, like you said, the long bones, the collarbones, and what have you, flat bone, like the shoulder that you just said. So you must be able to identify what type of bone it is. All right? Okay. What else about the bones?
Then you have a type of joints.
Type of joints. What about the joints?
You have the ball and socket one.
Yeah, the ball and socket joint. And what's so
Yeah.
special with the ball and socket joint?
It's movable.
It moves. It's freely
It
movable.
rotates. Don't tell me it's movable. All the joints are movable.
It rotates.
That's the one.
Right. Rotation, that means you can walk.
Round. You can move it around in a circular motion.
And when you go to the field to exercise, you guys do like that, and then they do
Yeah,
the foot up like that, and that's ball and socket. So here's ball and socket, here's ball and socket. So what are the others?
The hands, the feet.
No, what type of bone, what type of joints are the others?
You have
You just have a ball and socket, what are the type, other types you have? What are the other type?
You have the
You have the hinge joints,
The hinge.
please.
hinge joint.
Hinge joints, all right? Hinge. This is hinge joint. Kick a ball, hinge joint. All these hinge joints, hinge joints. All right? Come on, what else?
Yeah.
bone. You call it bone to what?
Different joints. Different kind of joints.
You have the bone that you have to move. No, let them move freely. No, you connect ligament, right? Bone to ligament.
There are types of joints.
Ligaments, tendons.
He's
We
talking
just start
about
with the
type
words.
type
What
of
else?
joints.
What else? Anything? Come on, what else? What about the bone itself?
You have the bone marrow,
Bone structure.
bone structure.
Right. So we talk about the bone marrow, what else?
Ligaments? No.
Bone
Tendon.
structure.
Guys, look at the look for the periosteum. And you need to know the periosteum, guys. Look at it, please. Because when you're gonna start talking about fractures, you gotta know that.
A periosteum.
Please look at it, please. Bones just don't just break and they get better. What caused it to fix or to
Periosteum is the fibrous connective tissue covering the bone. This is the fibrous connective tissue covering the bone. Periosteum, osteum, osteum.
And look under the periosteum, what you have is in next there under the periosteum. Look at the cross section. That's why you guys gotta walk with your laptops and just kind
Here's the
of.
most common type of cartilage. Synovium, striated. PRIO.
Alright guys, when you go home, look at the periosteum, look at the cross section, right? Because we don't have that time right now.
Endosteum.
Alright? Look at the endosteum and everything and see what grows up. Because you gotta see how bones are,
Endosteum.
how they heal.
Endosteum.
And what happens when you call it reduction? Why do they have to put bones in line? Because if the bone heal in a certain way, you're gonna have problems. Alright, so you gotta know this, alright? So that's a normal. This is not anything abnormal we're talking about. This is the basic thing that you should know. Alright, guys? We ain't starting nothing abnormal. All we're doing is just going over your normal systems. So, but I want you to understand that with these you have to know, because when we're doing the pathophysiology, and we only have 4 weeks, and in the 4 weeks, I'm not going over, it is one continuous, every day. If you miss a day, I'm sorry, but it's Wednesdays and Thursdays, you come on Wednesdays and Thursdays, and that's it. In 4 weeks it's over, and there's a lot to cover in 4 weeks. It's too much, really, it's a lot, it's too much to cover in 4 weeks. But we'll just to see what can happen. But you gotta know this, what we're talking about here, because each part of your body can be affected by something. And I don't want you to look at it from a doctor's point of view, as I always say. You're not trained to be no doctor.
Joint pivots.
Look at it from that perspective over there, nurse, and what you need to do as a nurse. Okay? All right, what's next? What else does it do? Oh, by the way, what else does the bone does?
What else does the bone does?
Thermoregulation heats. That's
Hmm?
the
What else your bone does for you? We talk about it gives you what is the function of the bones? What was the function of the bones? I didn't hear the functions.
it's for regulation of heat as well,
Movement.
Mm.
and also it produces the blood,
No. Let's talk about what's the function of bones.
Oh, bone marrow.
produces blood, red blood.
Only red blood?
No, all blood in general. From the
Produces the cells.
okay,
Erythrocytes.
Okay.
Erythrocyte.
erythrocytes.
Shapes, it provides shapes.
It produces leukocytes.
Leukocyte.
It produces thrombocytes.
Thrombocyte.
It produces your lymphatic cells, your T cells and your B cells are all produced in your bone.
Bone marrow.
Bone marrow.
What's her name again?
Sheila.
Come, don't look at me like that. I have a very difficult time with people's names, and that's no problem with that. You look surprised to hear that the bone produces those stuff.
I thought it was just
But
blood.
that's what the bone are. That's why when persons have such things as leukemia,
Hmm.
they want to do what?
Bone test,
A bone biopsy,
bone biopsy.
Bone marrow transplant.
right? To see what is causing persons to get leukemia, what is causing it. Because the bone marrow is responsible for producing all of these things. So your bones, it's not just for structure, your bones is not just for shape, the bones
Function.
are not just for support, but the bones produce everything that you are. All the blood cells you got is your bone. All the white blood cells that fight for you, your bone. All those blood cells that are responsible for causing the clotting, to prevent bleeding, the bone. And when they give you those fancy injections for your memory cells, it's the bones. So you can get vaccinated and become what? When you're vaccinated. You have a defense, right?
Uh-huh.
It's all in your bone. So don't just look at the bone as something for structural thing only. It has a lot of different functions. Right? And why we do certain tests along with it. Next,
Nervous system.
nervous system. Where anybody go? Come on, anybody.
You have a central nervous
The
system.
brain, spinal cord, and nerves are the organs of the nervous system.
I want you guys to talk about it. I don't want you to read nothing. I want you guys to bring it out from your head.
CNS, you have the CNS.
You have the CNS, and what about the CNS?
Central
That's the
nervous
central
system.
nervous system.
It's there. Central
Nervous
nervous
system.
system. And what about the central
Consists-
nervous system?
Consists
brain
of
and,
brain
and the spinal cord.
Consists only
Only.
The brain and the spinal
of the
cord.
brain and spinal cord. What else?
Peripheral nervous system.
You have the peripheral nervous
Peripheral
system.
nervous system.
What else?
Message,
You have the
carries.
somatic, you have the
That's what
somatic.
carries the messages from the brain to the body.
What? Efferent and afferent. Right?
Efferent and
What's
afferent.
efferent?
Afferent take message too, right? And the afferent take it away, bring message in from the body.
What's
to the brain.
efferent? Why don't just tell me efferent and afferent. What do you understand by efferent and afferent?
Take the sensory
Which one take?
information.
Take it
remember.
in.
You know, you're gonna be asking, which one?
The afferent.
I think the efferent take message
I'm
away.
thinking nothing here. We give the facts. What are the facts? Give me some facts, guys. Efferent and afferent.
Afferent. So the afferent take message in.
What does your efferent blood vessels or your efferent nerves do for you? E-F-F-E-R-E-N-T. Efferent and afferent.
Afferent.
Why are you looking it up in your book?
The efferent would take the message away
Take it away. Okay.
Mm-hmm.
And the
And,
efferent, okay.
To a target.
To the brain.
To a target muscle.
So the afferent take
Takes
message
the
to the
message
brain.
to the brain.
So the afferent, right?
And the afferent would bring it to the brain.
To the brain. Okay.
Receive
Sophie, how many cranial nerves do you have?
cranial nerves.
All right.
12.
Well, how many cranial nerves do you have?
How many cranial nerves I have? 12.
Okay. 12. 12 cranial nerves.
12.
Why do you need to know the cranial nerves? Why do we need to know the cranial nerves?
Because nerves.
Why do you need to know?
Nervous
You have
system.
12 cranial nerves. You guys reminded it.
Yep.
What is motor? What is sensory? What is both? You guys did it, right?
Yes.
But you forget it already.
Not entirely.
No.
Not entirely.
Actually, right? But
Cranial
it's where
nerves.
this will talk, where as we get into pathophysiology, you gotta remember these things because you don't know what part of the brain is affected
Yeah.
or would affect
Part of the body.
the part of the body, such as when you have TBIs and what have you. All right, so. What is the basic cell structures? What are the cells of the nervous system called?
The cells in the nervous system.
Neurons.
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 You have nephrons to the kidneys? Neurons.
Neurons to the brain.
Nephrons for the kidney.
So what protects the brain?
The brain.
Synovial fluids.
The what?
The synovial.
What?
No, the
No.
Cranium.
cerebrospinal fluid.
All right, CSF. Cerebrospinal. But is that the only thing that protects the brain?
No.
What else protects the brain? Why are you looking wrong?
The
Stay
skull.
focused.
No, not skull.
All right.
Cranium.
The cranium.
Your cranium protects.
Defense skull.
Yeah.
What else protects the brain?
The spinal cord.
What are we talking about
The
the brain?
spinal cord gotta be protected, right?
No. The what that
You
fluid?
just
is?
said,
Protected
you
by
said
the
the cranium,
Cerebrospinal
right?
fluid.
Cerebral spinal fluid.
You said the cerebrospinal fluid.
Mm-hmm.
Yes. Anything else?
It's
What
protected
about
by the
pia
bone.
mater and
The meninges and
Go again. Go again.
pia mater?
dura
Dura
mater.
mater.
Dura.
Dura
The
mater.
dura mater is the one that's going to protect the brain because that's the what? The outer
Outer.
covering. And what's the middle layer?
Dura pia.
What's the middle layer in the layer?
The middle. Pia mater. The
Now
dura
you have the
mater.
dura pia. And what's the other one? Dura mater, pia mater. I don't know.
The blood.
It will be your arachnoid. Because remember when a person has bleeding,
Yeah.
it's subarachnoid is where you have all of those blood vessels and what have you. So when you get something called subarachnoid hemorrhage, you find a lot of people get these, see it written there by the doctor's diagnosis, subarachnoid hemorrhage. It's in the arachnoid area, under the arachnoid. So sub is under, right? And then under the arachnoid is the what? You have that arachnoid space. Then you have next is the pia mater. And all of these, when combined, is known as your. When you put together all these layers of the brain, it is known as the. I'm doing what? I'm speaking Japanese now, right?
It's known as the
It's called the meninges.
meninges.
What is your meninges, guys?
Covering.
So what did I ask? Did I ask something else? I asked the covering, right? Alright, so the meninges. And this brain has different parts. So what are the different parts of the brain?
You know, the pia mater, arachnoid, dura mater.
I want those are the lining of the brain. Remove parts of the
Yeah,
lining.
with cerebellum. Cerebellum.
Have a question?
Cerebellum.
Yes.
Cerebellum.
Cerebellum, cerebrum, and your
Pons.
pons, medulla oblongata.
Medulla oblongata.
Okay. What else do we know about this basic anatomy physiology of the CNS?
So you have the peripheral. Peripheral. No, you have this
We just start with the
sympathetic.
brain. Next we have what?
Spinal
Spinal
cord.
cord.
Spinal
So what can you tell me about the spinal cord?
Spinal
Basic,
cord.
nothing abnormal. We're not talking anything abnormal. Everything is a normal. So what about the spinal cord? What can you tell me about the spinal
It
cord?
runs down the vertebrae column.
It runs in the center of your vertebral column, right? Okay, good. What else?
What else it does?
Cervical and thorax.
Spinal cord.
It connects to your brain.
What? That's what's in context of your brain? And what you saying there?
Your brain and your lower back.
Yeah, the vertebrae column.
Cervical, thorax.
You're talking about the different types of vertebra. But tell me some more about the spinal
Spinal
cord.
cord.
Come on, guys, tell
The
me about the
message-
spinal
It's a
cord.
The message goes-
the structure.
The messages is carried to the brain through the spinal cord.
Messages are sent to and from the brain by the spinal cord.
Yeah.
What else?
It's a cylinder structure.
Cylindrical shape.
Cylindrical shape
Okay.
structure.
Mhm.
And it combines of fluids and
Right.
tissues.
Spinal
Tell me the spinal cord. Just in your own words. Don't go into anything. In your own words, what you've read and what you understand.
Is a bony column. And it protects by this.
It's not bony. What's a
It's a
spinal
cord.
cord? I didn't say the spinal column.
It's a cord.
Don't mix up the column with the cord.
The nerves.
It carries those efferent and afferent messages, right?
Yes.
Where cranial nerves and all that being involved,
Yes.
right? Send these messages back and forth. So it's a pathway for messages. And if the spinal cord gets damaged,
Yes. The
it's going to
message
affect
goes
what?
to The brain.
How will it affect the body?
You can get paralysis.
No, the message wouldn't be able to go through, right?
Yeah, it will block from the point of damage upwards. It will be interrupted.
Upwards?
I'm sorry, downwards. It will be interrupted because the brain cannot correct to that point that it wants to get. So
All right, guys, so when you're doing the medical terminology, such things as paraplegia, hemiplegia, quadriplegias, or the paresis, you got to talk with the spinal cord. Okay, and at what level? And you were mentioning just now the different vertebrae, be it the cervical, the thoracic, your lumbar, your sacral, or your coccyx. But also what I want to hear is you like, what is the length of the spinal cord? The spinal cord ends at the level of your first and second lumbar vertebra. So now when you're going to do a spinal tap, it will be between the third and the fifth space,
Yes.
lumbar space.
Third and the fifth.
Those are the things I want to hear you talk about. But those are basic stuff. That's not getting into the nitty-gritty. It's so that you understand what is your role when you're doing what. When you have to hold that position for spinal tap or for what?
Meningitis.
Epidural.
Oh,
Epidural.
epidural, okay.
Right?
What about
Your
meningitis?
babies, if you have babies and have the epidural,
Meningitis, huh?
you gotta know where they actually would do it without actually damaging something. All right, and of course, is when we talk about the spinal column, you want to look at the different shapes of the spinal column that will come in the skeletal, which would be like your kyphosis, or scoliosis, or your lordosis, and how it affects that person. When persons have things such as changes in the spinal column, such as you have car accidents or degenerative changes that impact upon the spinal column, why people get pain. Remember, if you do not have the sensory nerves picking up sensations to get to the brain, you're not going to feel pain. Somebody could be chopping your foot off, but if the sensory nerve do not get that message to the brain,
Yeah.
you can chop the foot how much you want, the person will know how enough. Alright? So it's so important to protect the spinal cord. That's why you have a spinal column. But unfortunately, a lot of our young black men today are being shot. And when they shoot each other or whatever, they damage the spinal column.
Yes.
And very few people get damaged spinal column from regular things that you do. Most times we find damages to spinal column in our society is due to gunshot wounds. You got one case that you talk about a lot, because you have car accidents. It can happen during car accident. But the one that we know a lot about is the one that happened to Superman,
Yeah.
Steve Reeves. Right? He broke his neck riding a horse. Got thrown off the horse. And he became a spokesman. He didn't let that keep him down. He could, from his neck down, he became paralyzed. And this is a man who was Superman and running and jumping and doing all kinds of stuff. Now he couldn't do anything else. He had to he had to rely 100% on somebody taking care of him. He couldn't do anything anymore for himself.
Yeah.
But he didn't let that keep him down. He still go out there and talk in his wheelchairs and his what, and somebody there with him to say, things that is in society until he died. And of course, when we doing things like that, we'll be looking if a person loses sensation and mobility, how does it affect the patient? And use a nurse. Okay. What are the systems? Move on.
I think that's it.
We CNS is neurological.
I think that's it.
What about the integumentary? We did that already?
There you go. Tell them that's not it.
Skin.
The skin. What about the skin, guys? Integumentary.
That's the biggest organ in the body, the largest organ.
You guys remember that? Test me if you remember. Largest organ in the body.
It is.
Protect you from.
It protects you. What
Yes.
else?
It protects you.
Come on, guys.
Organ in the body.
We talk about the normal. We're not talking about anything abnormal. Don't want anything abnormal. Swing them here with all the abnormal stuff. Tell me what's the normal stuff your skin do for you. It protects. All right. It protects the internal organs. What else? It protects. It keeps you warm, of course. Temperature regulation. Good. Next. What
You
else?
have the epidermis, the dermis, and
It has epidermis, dermis,
and subcutaneous.
subcutaneous.
Subcutaneous. Yeah.
Muscle
3 layers.
layer.
Yeah.
Layers of muscle.
Yeah. 3 layers.
You guys should remember that because you did the GI teach you feed-ins, and you talk about hypochlor,
And it's made up of water.
hypodermolysis, and all them sort of nice stuff. What else with the integumentary system?
It's made up, it's made up of water, and it protects the fat and fat and the minerals.
Think about your skin. Think of your skin right now. What it does for you. Think of it.
You can feel sensory.
You can feel
Yes.
sensation of touch, right?
Right.
Right, and
Feel?
it protects your body from germs,
all the time, exactly.
And,
Keeps in moisture, right?
And the ones that the particular germ that's protecting you from is which one specifically?
Which one?
All right, the staphylococcus.
Staphylococcus.
All right. What else about the skin? Come on. What are the appendages of your skin?
The nail,
The
the
nails,
the hair.
and your hair.
and your hair.
Right.
Yep.
And a lot of stuff happening with the skin. That's why you need to know the different areas. So you're talking about tuberous ulcers, burns, invasive procedures. So everything is related to their skin.
And then it helps regulate so you can feel cold when we feel cold and we feel
Right, that's what
warm.
the young ladies talking about the temperatures, school
Right.
regulation of temperatures. All right, now, that's a normal situation. But then you have to put everything into the right context. And to put them in the right context when you come to pathophysiology, you have to now know something about your concept map and your what?
Care plan.
Care plan. And when you do your concept map, is it in order for you to do what? Develop your care plan. So in your care plan, what you should have in your care plan? What are the main points in your care plan?
To assess.
Assess.
First thing starts with assessment.
Assessment,
And what are the type of assessments you have?
diagnosis.
Objective.
We uses the mnemonic
ADPI.
ADPI, right?
Mhm.
But as trained nurses, you don't use those 5, you use 8. Right? All right, so the first is assessment. Sorry, you guys are graduates. Right?
Diagnose.
So, assessment, on assessment is what?
Subjective and objective data.
Subjective, objective. What is subjective data?
Questions you ask the clients and what it subjective
Subjective. What does the patient will
tells you.
tell you? I'm feeling cold. I want to pee. I have a headache. That's what the
Subjective.
patient is telling you.
Yeah.
Then what's the objective?
Data that you collect.
What you collect.
What you can see for yourself.
What you can see, what you can
Measure.
measurable goals, and not goals, measure, things that you could see. Like you could see vital signs on your, on those machines. You could see lab reports. Right. You could see a patient shivering. Right. You could see blood in the stool or blood in the urine. Those are all objective. And then what's next?
Diagnosis.
Diagnosis.
Systemic
Diagnosis is what?
Nursing diagnosis.
Nursing
The diagnosis based on the diagnosis
And what
of
is
the
it?
doctor.
Nursing is based on what?
Based on the doctor diagnosis.
It's supported by the nursing, by the
Right.
doctor's diagnosis. Absolutely. And the nursing diagnosis, what you should know about the nursing diagnosis. What you should know about the nursing diagnosis.
Nursing diagnosis. The nursing diagnosis is different from the doctor's
It's
diagnosis.
based on the complaints of the client, or is preventing a worsening of the current condition. It's like it can be.
All
It
right,
can
give me an
be.
example of a nursing diagnosis, guys. And when you give me an example, tell me why you give the example. Give me
Okay,
an
a
example.
person may have pain
Right.
as a complaint, and you want to say pain related to the diagnosis may be angina pain, and that would be an example of a nursing diagnosis.
Patient diagnosis would be acute pain.
Acute pain,
Acute
yes.
Or alteration in comfort related
Discomfort.
to chest pain. Okay, so it's a nursing diagnosis. What's next?
Implementation.
P.
Planning.
Plan.
P is a plan and goal. So what's your goal? What's your goal?
Alleviation of the pain.
The patient have no
What are the
pain.
criteria that you have to maintain?
The criteria.
Like, whatever
What's
the
the
doctor
criteria?
prescribed.
What's the criteria for your goal?
Oh, okay.
It must be measurable.
Measurable.
It must be realistic.
Pain scale.
Right?
Can use the pain scale to measure.
So it must be either short term or long term.
Mhm.
And must be a realistic thing, not something you just taken out of a book. Must be specific to your patient. And then you implement. And then what you implement. But remember, when you're doing this now for the nursing part of it with student, when you do your
Implementation.
diagnosis, you must come up with your pathophysiology.
Mm.
When you do your goal and then your implementation,
Reason.
you have to come up with your
Rationale.
why you're going to do something.
Mm.
And for your goal is what is your expected outcome.
Mhm.
So it's going to be assessment, then it'll be the nursing diagnosis, and with the nursing diagnosis you will have pathophysiology coming next.
Mhm.
And then after the pathophysiology, next will be your
Plan.
Planning.
goal.
Goal
And
plan.
then your goal, you have to have your outcome.
Rationale.
And then after your outcome, you
Outcome.
have your implementation.
Implementation.
And when you have the implementation, you have to have your
Rationale.
rationalization, why you're doing this. And lastly, you will have
Evaluation.
And everything that you do, every disease process, you have to do it that way. Guys understand?
Yep.
So if you talk about a broken leg, what about a broken leg as a nurse you need to know? How was it the patient's complaining of? Maybe pain, maybe mobility, maybe body deformity. All of those are just, there were 3 different nursing diagnoses. So what are you going to do for each one of them? That's how you do it, all right? Okay, move on from that. All right. You guys just had a quick overview because from tomorrow and onwards, it's not going to be no overview, no systems. You know the systems? Please go over the systems. Go over the basic systems. So that as I hit the pathophysiology, you'll have more of an understanding. Okay? We will review the system today, and you could see areas where you were a little foggy. Try to clear it up. So then we can start now making that comparison. How disease affects systems. What is your role and how, what you're going to go, how you're going to go about managing it. All right? That's what we'll be focusing on. So please. All right. Any questions until now?
So the pathology is the reason or the rationale that we are implementing?
Pathophysiology is disease.
Disease.
Pathophysiology of disease.
You have your eyes. Your eyes is normal. You can see, right? When something goes wrong in the eyes, that's a patho. Patho is disease. Physiology is how it works. It's like anatomy is a body part. Physiology is how the body parts work. Same thing, patho, disease. Physiology, how the disease works and how it affects
Disease
you.
process.
So the same concept. And do remember, everything that you do in nursing is based on concepts. Everything. Also, from basic things you need to remember, things such as vital signs, you need to know your vital signs, right? Normal vital signs. You also need to know what is inflammation, inflammatory response, right? Which will be what? Pain,
Swelling.
swelling, pain,
Loss of function.
swelling, loss of
Loss
function,
of function.
fever, heat,
Redness.
Redness.
right? Those are 5 things, and once you remember that, know that whenever you come across an infection, you may see all, or you may just see a few of them. but they are indicative of an inflammatory response. So when you're doing about the inflammatory response, now you have to look at anti-inflammatory medications, right? What will help to bring down those inflammatory response? You're also looking at antibiotics, if it's an antibiotic that's causing, if it's an infection is causing, and getting the appropriate antibiotic. Or what you will do as a nurse for non-pharmacological interventions to help that patient. Okay? So those are things and how you look at it. And remember, again, please, that you always start with your non-pharmacological approach first. What you will do as a nurse before you go into what the doctor will do. Because the doctor makes the orders and you will follow the orders. But what will you do when the patient is complaining? Any other questions? See, nobody didn't want to talk about it.
No.
Psychiatry. What do you understand by psychiatry?
Mental disorder.
A mental disorder, what do we mean by a mental disorder?
This person can be depressed.
A person can be depressed, okay? What? Why do you keep mumbling?
It might be a mental breakdown also, or is that the same?
Or nervous
A
breakdown.
mental breakdown. Okay,
Nervous breakdown.
okay, nervous breakdown.
Loneliness, isolated.
What's that?
I said loneliness or isolated.
Loneliness and isolated. I mean, I just
Isolation.
understand that there are connections. For instance, when you do maternity nursing, and you talk with a woman just had a baby, and so then she take the baby and throw through the window,
Yeah,
right?
postpartum
Whether the
depression.
patient, whether she's having, stay with me, postpartum blues, which is different from postpartum depression, which is different from postpartum psychosis. And they have time frames. Okay, guys? And when you're looking at psychiatric disorders, you're looking at nervous disorders versus psychotic disorders. Because when you're looking at the medications, and you base that the patient is having anxiety or the patient is having schizoaffective disorders, things that they have lost fluctuating reality. You can see how it affects. Right? Like you know what dementia, right?
Yes.
Short-term memory loss. Patient has dementia. But then dementia can be due to a person having high blood pressure. Isn't that so? You guys are good, you know. High blood pressure can cause dementia. And dementia is called vascular dementia.
That's right.
Will that come under psychiatric problems? They should have behavior, right? Severe seem to walk in the room to get knocked down or to run down the house or to do something stupid. It's all part of the process. Now, anything that we talk about today that you have a little about, anything. Because I know it is a quick review, and I did a quick review just based on the fact that you guys have done this before, and before we stepped into the pathophysiology. So anything that you, from your previous classes, from now, what is it that you have concerns about? What concerns you have?
Okay, so I'm not sure this is a concern or is it really more of a question. So I know that we will finish next month, so there's gonna be an exit exam sometime in May. So I guess my question would be, maybe approximately what date?
Can't tell you. Don't do that.
Okay, so how many questions?
I will not tell you that either. You're not gonna know how many questions, you're not gonna know exactly. I will let you know at least a week before.
A week before?
Yes. Okay, that's only gonna happen.
So would you give us a day of, like, we really gotta cover for the final exam, everything that we did in the class?
All right, your final exams. All right, you guys over here are the graduates already. These are courses we're going to be graduating. So I'm asking questions about you. Just quickly, just tell me. When you're going to be having, everything is based not only on, and that's why I answered the way I answered this now. How many absent days you've had? How many late days you've had? All right. That will be taken into consideration. Not just the test that you'll be getting, because just having the test will just say that, you know what, this person did bad, but why did this person do bad? What are the days that you were absent and what is taught in those days? Did you do your readings? Because nothing that will be given in the test will be something out of the blue. Nothing. Everything that you've covered. And the final test, then we just simply, like I said, when you do your state boards, you don't know what's coming. So simulation is state boards, you don't know what's coming. You just study. What comes. Alright, so we'll be prepared totally for everything. Alright, you guys over here now. Any questions?
You're gonna read up and be prepared.
Well, I like what you've done, because as I know from when I left your class, you know, I can see you continue. And, which is good. Which is good. You know, tomorrow when you come into the classroom, we will start off on one of the systems, and each day we may do 1 or 2 systems with packet as well, because only 4 weeks. 4 weeks is the next, and then next month. So it's going to be a this.